tomorrow in the UK, some people in the front line will start to get their first vaccination. How far away is the US?
Well, assuming all the data checks out as we expect it will, not that far away, probably within a week or so.
How much of a game changer will that be? Do we only really, say that a vaccine is a success once we understand distribution? Like, is the regulatory approval much easier than what we can face afterwards in terms of distribution and freezing?
Well, I think the big picture is it is fantastic to get a safe and effective vaccine against a pandemic that is killing now 2,000 or 3,000 Americans every day. And it is the path for this country out of the pandemic. But getting there is going to be challenging, just like you say. We'll have the regulatory review starting this week, and then the vaccines will start. But it's going to get more and more complicated as the goal is to reach the highest risk people as soon as possible. And the better we do that, the quicker the pandemic will end.
Yeah, and Britain already has questions about massive mobilization, A, to get people to take it, to have the right distribution system, but also C, to decide who gets it first. How much more complicated will it be for a country the size of the US?
It'll be complicated because it's being done through the states, and we know the states have very different public health systems, different capabilities, and there'll be a lot of variation, and we'll see some things that work and probably some things that don't work that well. But over time, as more vaccine becomes available, more people will get vaccinated. If we do it well, the pandemic will end sooner.
How difficult will it be to convince some medical workers and the public at large to take the vaccine?
Well, I think that's why this week's meeting at FDA is so important, because it's one thing just to hear there's a vaccine. It's, great to hear it from the company. But what we're going to see is the methodical, thoughtful review of career scientists at the FDA who are doing analyses of the data directly from the data files. They're going to be talking about what it means. We're going to hear from independent advisors who are going to be asking some of the questions that a lot of Americans have. And I'm hopeful that at the end, the explanation will be clear enough that a lot of people are going to understand the value of a vaccine.
We are putting so much effort in talking about the vaccine. Do we need to remember to also talk about the approach to testing and track and trace?
Yes, well, right now we're facing just this enormous surge, a surge upon a surge, as Dr. Fauci said, and really taking this situation seriously is critical because we are losing many, many lives while we're trying to get to a vaccine. Testing, tracing, all those items of disease control are going to be important, at least very important, for another 6 months. And again, the better we do that, the fewer people will die or get seriously ill.
Dr. Sharfstein, once we have a vaccine, does it mean that social distancing can come to an end, or how long will it take from the last person to have the vaccine from when we truly go back to what it was like in 2019?
I think the key is going to be to keep an eye on community transmission rates. When we start vaccinating just a few healthcare workers, people in nursing homes, the transmission rates are going to be high. We're going to need to keep social distancing. Otherwise, the virus is going to spread like crazy, as it is doing right now in some places. But as that community transmission rate goes down, as the areas go from red to orange to yellow to green, then things are going to start opening up again. Restaurants are going to have indoor dining at greater and greater amounts, and it's going to be safer and safer to do things. I don't think it's going to be like flipping a switch. I think it's going to be gradually the lights are going to come back on, and one day we're going to wake up and realize that we're pretty close to back to where we were.
And we understand, there are a number of questions that we need to answer about this vaccine. How long does immunity last for? And once you get the vaccine, whether you can still transmit the virus, even if you don't become sick yourself. When will we have some of the answers to these questions?
I think over the next, 4 to 6 months, we're going to understand a lot more about how good the vaccine is. It is obviously very good to prevent severe illness and death. And so that's very important. And then we'll see about these other elements of the vaccine as it rolls out. Partly, we'll see how quickly that community transmission rate comes down as more and more people are vaccinated.